Good afternoon, everyone, and welcome to our webinar on the Public Health Infrastructure Grant, or PHIG, Promising Practices Initiative. We are super excited to have you here. I'm just going to go over some housekeeping items really quickly. So this webinar is being recorded, and by participating, you consent to the recording. The recording will be made available on the PHIG Infrastructure website after the webinar, and we will be answering any questions at the end of the webinar as time permits. So if you have a question, please use the Q&A chat box function. Also, please feel free to use the email addresses that will be provided at the end of the webinar if you have any additional questions, as we will try our best to accommodate questions, but we recognize we may not get to all of them. Next slide, please. Thank you. So before we actually dive in, we would like to acknowledge that this work is supported by funds made available in whole from the Centers for Disease Control and Prevention, also known as CDC, of the U.S. Department of Health and Human Services, also known as HHS, National Center for STLT, Public Health Infrastructure and Workforce, through OE 22-2203, Strengthening U.S. Public Health Infrastructure, Workforce, and Data Systems Grant. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by CDC, HHS, or the U.S. government. Now, I'm going to pass it to Christina Chung, our CDC evaluation lead for the Public Health Infrastructure Grant.
Thanks very much, Rashida. Thanks everyone for joining today, for being on, recipients and presenters, and some of our CDC staff. I am Christina Chung. Like Rashida mentioned, I'm the evaluation lead for PHIG at the CDC, and I work really closely with our national partners, FAB and PHI, who help coordinate and implement the PHIG evaluation work. My role today is pretty minimal, but I'm going to be here to help introduce the speakers and explain a little bit on why this project is so important for the Public Health Infrastructure Grant. Next slide, please. So with that, we have a few speakers today. You've already heard from one, Rashida Mohammed. She is the Senior Research Specialist at FAB, who is leading the Promising Practices Initiative and also works on the National Evaluation for PHIG on the FAB side. We also have Sylvia Alt from Indiana Department of Health. She'll be presenting on Indiana's Regional Technical Assistance Teams, which was recently identified as a PHIG promising practice. And last but not least, of course, we'll also have Dr. Carrie Pride from Montana Department of Public Health and Human Services presenting. And she'll be presenting on the Pathways to Recognition Learning Collaborative, which was also identified as a promising practice. Next slide, please. So just a little bit before we dive into the main content today, I did want to share a few words on why this project is so important to us and what it means for the Public Health Infrastructure Grant and how it aligns with some of our goals. So as most folks probably know, one of the goals of the evaluation work is to help build and strengthen the evidence base for the three grant strategies: workforce, foundational capabilities, and data modernization. We know through the evaluation work, from listening to our health departments, that recipients really want to learn from each other in terms of what's working well, what doesn't work. And with the Promising Promises Initiative, we really want to be able to, basically take forward what we've learned from everything that you all are doing to help identify best practices and lessons learned so we can take them forward during and even after this 5-year cycle of the grant concludes. So with that said, the Promising Practices Initiative is really, just one way of meeting that goal to strengthen the evidence base for public health infrastructure across these three strategies. The intention of the initiative is to help create usable resources to help health departments implement identified practices. So promising and best practices, which I believe will be eventually featured on the Public Health Infrastructure Grant website. And that's really to help support the spread and sustainability of the gains from this grant. So with that said, I'm going to pass it back to Rashida, I think. Great, Rashida. Okay. To speak more about it and to kind of go over what's coming up in the next, like I would say, 54 minutes or so. So go ahead, Rashida.
Thank you so much, Christina. And Christina just shared a brief welcome, and she also shared the following background information about PHIG and the Promising Practices Initiative. So CDC's Public Health Infrastructure Grant, or PHIG, is a groundbreaking investment supporting critical public health infrastructure. The purpose of PHIG is to implement activities that strengthen public health outcomes. PHIG's funding model gives health departments the flexibility to direct funds towards specific organizational and community needs. To assess PHIG's impact and ensure that the grant effectively supports public health organizations across the country, a national evaluation of PHIG is currently underway. The National Evaluation Team, or the NET for short, leads this important work. The NET created the PHIG Promising Practices Initiative to amplify the impact of PHIG by showcasing practices submitted by PHIG recipients across the country. Today, we're going to discuss how the initiative works and how you can get involved. You can go back one more, Sarah. Thank you so much. So today we'll get started with a brief overview of the Promising Practices Initiative, including our goals for the initiative, how it works, and who can contribute. Then we'll discuss the criteria that the NET is currently using to evaluate any practices that we receive. We'll then highlight two examples from the Promising Practices Initiative pilot that we launched last summer. And then we'll share a preview of our communication strategy to maximize the reach of this important work. And finally, we'll wrap up with ways that you can get involved in the initiative. Next slide, please. So first, let's start off with what is the Promising Practices Initiative? Next slide, please. The Public Health Infrastructure Grant recipients have expressed a strong desire to learn from their peers' successes to inform their own strategies towards improving public health infrastructure. To meet this need, the PHIG National Evaluation Team, or the NET for short, has launched the Promising Practices Initiative to really showcase practices that PHIG recipients have implemented successfully. Next slide, please. So here's how the NET is defining what a promising practice is. So a promising practice refers to an action taken by a PHIG recipient and made possible through PHIG funding or support directly or indirectly. This action demonstrates evidence of positive change through interventions, activities, things like programs, strategies, policies, procedures, or processes. Next slide, please. The NET created the Promising Practices Initiative to truly amplify the benefits of PHIG. More specifically, the initiative will collect policies, programs, and initiatives that were created as a result of PHIG, so using PHIG funding or support, empower public health professionals across the country to adapt evidence-based approaches to their own work, and finally, support the spread and sustainability of evidence-based infrastructure gains. Next slide, please. So here's how the initiative works. PHIG recipients are invited to submit practices for consideration. Direct and indirect recipients can submit practices related to workforce, foundational capabilities, and data modernization, like Christina stated earlier. The NET will assess submitted practices based on a submission rubric and the level of supporting evidence submitted to us. We also want you to know that practices at any stage of development or implementation are welcome to submit. Anyone can nominate a recipient to submit a practice. The NET will evaluate practices on a rolling basis. Submissions and nominations will be accepted through the life cycle of the Public Health Infrastructure Grant. Selected practices will be featured on the publichealthinfrastructure.org website. Practices that demonstrate the strongest evidence base will be recognized as promising or best practices within the context of the Public Health Infrastructure Grant. And we'll share more details about how to get involved at the end of this session. Next slide, please. Now let's talk about selection criteria. So what is the net really looking for in a practice? Next slide, please. Here are the characteristics that we're looking for in a promising practice. So first, a promising practice must produce measurable and desirable results related to the objectives. Next, a promising practice has to have a high potential for replication in other settings. A promising practice has to involve relevant interest holders in decision making. A promising practice should be ethically sound. And a promising practice should be accessible and distributed evenly to those it is meant to impact. Next slide, please. In evaluating practices, we're going to consider several factors. So first, again, it has to produce measurable outcomes, meaning the practice is designed to achieve specific, quantifiable improvements. Second, it has to document some type of positive change. Third, it has to show evidence that it could be replicated in other settings. Four, it has to be generally accessible and distributed. This just means that the services, information, or resources pertaining to that practice are designed, located, and managed to be obtainable by the entire target population, regardless of geographic, financial, or physical barriers. 5, it has to be ethically sound. This just means that actions, policies, and programs are grounded in core moral principles, evidence-based, and designed to promote population health while respecting individual rights. So really proactively ensuring fairness, justice, and safety. And 6, it has to involve interest holders during decision-making. So this just means that there is intentional, structured, and active engagement of individuals or groups who are directly impacted or responsible for decisions and policies within the practice. Now, the last line, as you can see, has stars on it. And this is what we're calling the bonus criteria. So you will not be scored on these categories, but we wanted to include them to really acknowledge the variety of practices that we may receive while not being punitive in these particular categories. So first, we have potential impact, which means the practice has the capacity to influence health determinants, health outcomes, or the well-being of a population positively. Secondly, we have sustainability, which means it has demonstrated some type of cost effectiveness and shown that it can last over time. And third, we have innovation, which means it explores the use of ideas that may be novel to your health department. Next slide, please. As we evaluate submissions, we categorize practices as novel, emerging, promising, and best, again, within the context of the Public Health Infrastructure Grant. Selected practices from all 4 categories can be featured on the publichealthinfrastructure.org website. Promising enable FIG recipients to learn from practices across the spectrum at all stages of development and implementation. Next slide, please. So the net is going to be identifying promising practices in 2 different ways. So basically, we have 2 different pathways of surveillance. The first one is active surveillance. This involves proactively seeking out information about promising practices from FIG recipients. This approach helps us surface innovative or effective practices that may not be formally documented yet. So we have national partners, CDC project officers, and FIG recipients themselves that are participating in activities like national meetings, technical assistance, site visits, webinars, and conferences to really help us identify and gather information on potential promising practices. Once a potential promising practice has been identified, the NET team may reach out to the FIG recipient directly to learn more about the practice. And next, we also have passive surveillance. And this involves looking for potential practices in existing or routinely submitted data. So instead of actively reaching out to participants, passive surveillance includes strategies like reviewing existing success stories or recipient reporting data sources. So passive surveillance is what we utilized during the Promising Practices pilot last summer. Next slide, please. Next, we'll share some example practices from participants of the pilot we conducted back in the summertime of last year. First, we'll pass it to Olivia from the Indiana Department of Health, and then we'll have Carrie from the Montana Department of Public Health and Human Services. So passing it to Olivia first.
Hi, everyone. Like Rashida said, I'm Olivia from the Indiana Department of Health, and I will be talking to you about our regional technical assistance teams that we are funding through PHIG. So next slide, please. Next slide. So Indiana's promising practice, like I said, it was our regional technical assistance teams. And these came into being because prior to PHIG being awarded, Indiana did an assessment of our local health departments and essentially asked what they would want to spend this money on, how they want it to be given to them, things along those lines. And the overwhelming response was essentially they did not want the money themselves, that it would be actually more of a burden to be going out and doing the hiring, tracking the funding, stuff along those lines. So we created teams. We divided the state up into 3 regions. And these teams include regional directors, financial analysts, MCH specialists, and school health liaisons, among others. So these teams are local to their regions and they can travel throughout the state depending on what the locals need in a given time. So if locals need someone to fill in for a position that has been vacant or they're going to do a clinic, anything kind of along those lines, they're able to step in and be a resource. So I wanted to focus on evaluating how impactful this is for our locals. So we have the funding from PHIG, but we also received funding from our state legislature for Health First Indiana, which was a huge investment for us here. It was something that hasn't really been invested in before. And so in conjunction with that, I created a survey that goes out to the local health departments once a year to essentially ask how the teams are helping them implement Health First Indiana procedures, practices, things along those lines, and making sure that we have the right people in place. So if they needed to tell us that we actually needed a different team member or they could combine different teams or things along those lines. So this survey has a mix of closed and open questions. So things like how often are you meeting with the respective team members, any success stories, challenges, how often are they coming and being on site? What are you able to accomplish that you weren't accomplishing before? And so far, we actually just wrapped up in December with the latest one, and people are having really positive responses. They are able to accomplish a lot more with these regional teams and with Health First Indiana money than they ever were before. And a lot of that is coming down to the locals. So, for example, since the regional team's implementation, they saw increased weekly blood testing go from 64% to 93% from the technical assistance from the teams. We've seen more LHDs working with local and state partners to address gaps and barriers in health services increase from 51 to 66%. So there's a lot of improvement being done across the state with this. So Many of our locals have been able to expand their public health services well beyond previous capacities. And our preliminary findings are showing that the regional teams have significantly been impacted by enhancing collaboration and expanding local public health services. And they're reporting having better relationships with Indiana Department of Health. They feel more supported with this model and are confident that their questions are going to get answered in a timely manner. So, all around, it's been a really positive experience. And we've been able to track that, like I said, through this survey that will be going out throughout the lifespan of the grant. I share the results of that survey with our regional teams so that they get kudos for the good job that they're doing. And if there are any changes that need to be made, any issues that need to be addressed, they're able to do that in real time because we don't want people to think that they're just filling out another survey and that they're seeing this is actually impacting the work that is being done with them. So that is Indiana's overview. I'm happy to answer questions at the end, but I think now I will be passing it on to Carrie.
All right. Hello, everyone. Good afternoon. My name is Carrie Pride, and I'm at the Montana Department of Public Health and Human Services. And today I'm going to be talking to you about our Pathways to Recognition Learning Collaborative. Next slide, please. And so with this, I'm going to describe what it is and then how this came about and how we're seeing impact. So what this is a learning collaborative approach for our local and tribal health departments to get technical assistance, peer-to-peer mentorship, to complete the pathways recognition standards and measures outside of FAB's timeframe. So it allows them to all come together, work together, get this ready, and then they are in a place to go ahead and submit with FAB to go through that year-long process. And the reason we did this, because in Montana, the majority of our large health departments are accredited. Our smaller ones, that's a little bit too big, and they were really interested in this, but to do this by themselves seemed a little bit of a mountain to climb. And so they wanted that peer-to-peer support to go through this together, to share ideas, and to look at all the different ways of meeting these standards and measures. So we worked with our Montana Public Health Institute, and so staff from the Institute and staff from our Public Health and Safety Division have this cohort approach where there's this learning collaborative, where here are the measures, how hard they are, when we're going to start them, when they're due, and they will go through this together by doing this coordinated support and TA through a virtual learning community where it's higher logic connected community where they can post questions, people can do responses that way, we can share documentation. There are also 2 monthly calls, virtual calls. One is required for their grant deliverables where they attend and say, we're going to talk about workforce development this month. Bring what you have, bring your questions, they'll work through something. Then there's a second call later in the month that's kind of a catch-up call. Like if I'm behind, how can I catch up, or I have these specific questions. In addition, there are 3 in-person meetings a year that allow people to get away from their health department, have a work session, dig in deep, especially on some of those bigger measures, and allows that real peer-to-peer mentorship on this. So it has been a lot of evidence for this with what we're seeing. With our first cohort that went through, and we're doing this on all of them, we go do a one-on-one site visit with them, go through all the standards and measures, and talk through, so we get a self kind of reported score of how well we're doing, right, in these domain standards and measures. And we repeated at the end. And in our first learning collaborative, there were 6 departments, and 5 out of those 6 are now with FAB, going through as the Montana cohort through FAB, which was really awesome for FAB to have that happen. But they're on their way to get their pathways recognition. And then we have a second cohort that just started here back in November, and we'll have a third one that'll start this spring. And when you look at those self-reported scores from the first one, they've all improved. And so we expect to see that with the next 2 as well. And what have been the impacts? There's been a lot for the state. We've had departments now. We actually had one join the cohort that isn't receiving any funding. They were just so excited from what happened with the first group that they're like, oh my goodness, I want to join. And so they joined without getting funding from the PHIG grant to do this work. We've seen this continuous quality improvement because now there are these standards and measures documentation out there. So departments, even if they're not pursuing this, might be like, oh my goodness, what do you have for X? And they're able to work with all these departments, get these documentations, and create things for their own department. We've seen, of course, updated plans and processes. Some of these departments maybe they had a comms plan, but it hasn't been looked at for 5-6 years. So it allowed them to update everything and have a process to do that routinely. It has also really helped with retirement and succession planning, because in that initial cohort of 6, 3 of them had health department directors change out. And so it has been a lot more of a seamless transition for those new directors coming in because, wow, we have all our plans, policies, procedures in place. This also has allowed a very objective review of performance, right, against a national standard. So this is a way for a health department to really look at their processes and say, how do we do better? With the support of our the staff member from our department and from the institute, who are both site visitors. So they look at the lens of everything on how does this look from our experience and knowledge of being a site visitor to help set them up, especially when they go through the pathways recognition formally. And the other thing that it's done has been very eye-opening for some areas that are just challenges across the state, especially when you think about performance management and QI. So looking at all the challenges there, it's definitely helped us think about, okay, what are some other training and technical assistance opportunities that we can spread more widely across the state of Montana to help our departments as they're doing this continuous quality improvement. So it has been a great program for us. And like I say, we're going to be starting our 3rd one, and there's the demand across the state for this. So I think that really helps speak to its impact across our state. And I as well am happy to answer questions at the end. So thank you for your time.
Thank you so much, Olivia and Carrie, for sharing more information about your practices at your health department. So finally, the NET is developing a communications plan for promising practices to really ensure that public health professionals across the country can benefit from the initiative itself. They can get involved and apply selected practices to their own personal work. Next slide, please. Here's a quick preview. So first, all submitted practices with enough information to be categorized will have a chance to be featured on the publichealthinfrastructure.org website. Other communication strategies may include email newsletter content, social media graphics, and accompanying text posts, and talking points about the PHIG Promising Practices Initiative for public health professionals. Next slide, please.
Apologies, 1 second.
No, you're fine. You're totally fine. Thank you so much, Sarah. So to wrap up, here's how you can get involved in the Promising Practices Initiative. Next slide, please. So if you are a PHIG recipient, you're invited to submit a practice. So we want it to be really modern. So we developed a QR code. So you can scan the QR code on this slide to access the actual submission form itself. Next slide, please. Here are a few other ways you can also get involved. Anyone can nominate a PHIG recipient to submit a practice. So that's going to be a separate form from the actual submission form. So we have the nomination form, and then we have the submission form. Again, we wanted to be very modern, so we developed a QR code. So you can scan the QR code on this slide to access the actual nomination form. You can also visit the publichealthinfrastructure.org website to explore selected practices, so you can identify successful strategies and apply them to your own work. You can also learn more about the PHIG Promising Practices Initiative at fabboard.org. And finally, you can spread the word about the Promising Practices Initiative within your professional work. And I will give a little more context about the publichealthinfrastructure.org website. We haven't loaded any practices yet, but it is our intention to sort of build that out on that website. So you can have a library of resources as it relates to the practices. So coming very soon. Next slide, please. So we really want to just take the time and thank everybody for sharing your time with us today and learning more about the PHIG Promising Practices Initiative. A lot of work across all the national partners as well as CDC has went into this initiative. And we really want to let folks know that the focus is the PHIG recipients. And if you have any questions about the Promising Practices Initiative, you can reach out to me at rmuhammad@fabboard.org or the Public Health Accreditation Board evaluation team at figevaluation@fabboard.org. So right now, we are going to go into our questions portion. Oh, somebody said there was an echo. Hopefully that subsided. Can the links to the two forms be shared? We can also share links as well. So we'll have the QR codes as well as the actual links. And Sarah, I see you in there typing. So for recipients that have been selected, what are the next steps? This is a great question, Elizabeth. So right now we are really trying to finalize a lot of our internal processes. So the actual next steps would be that we would reach out to those recipients that have been selected, and we'll let you know the next step in this process. It's going to likely be probably either receiving some TA for collecting information on the resources and tools that you utilized, as well as filling out an implementation template that we developed. And this implementation template is going to be really utilized for other recipients to be able to replicate what you did in their own personal settings. So these are all things that we're finalizing internally, and we'll absolutely reach out with next steps. Thank you so much for that question, Elizabeth. Could you please share the deadlines and timelines? So right now we don't have any hard deadlines. We're thinking about everything in quarters right now. So like I stated earlier, we really want to finalize our internal processes. You know, a lot goes into really finalizing an initiative that, you know, all national partners are working on. But as it relates to any updates, we're going to continue to update the FAB website, the public health infrastructure website with any important dates that are coming down the pipeline. So any dates and timelines and deadlines for sure. So no specific due date for actual submissions. So we're looking at this in the sort of perspective of the lifetime of the PHIG grant. So you can continue to submit throughout the entire PHIG grant. So the biggest thing about the difference between a promising practice and a best practice is really the evidence that we have requiring selection for that actual practice. So as I stated earlier, we're going to be utilizing a rubric, and with the best practice, that is going to be the heaviest burden, right? So novel is going to be the least burdensome, and best practice is going to be the heaviest burden. So we're going to require a lot more concrete, measurable outcomes. We're going to be requiring a lot of more concrete evidence as it relates to all of those different 6 criteria that we went over. So I would say the overall difference is that the burden of evidence is higher. Oh, no problem, Elizabeth. No problem. No issues whatsoever. So here to just answer questions. So if folks think of questions right now, feel free to type them in the chat. And again, you can also use the contact information here as well. And just to reiterate, this webinar is being recorded and the recording will be made available. So glad it was helpful. And again, we're super excited. Does the evidence have to be quantitative? It doesn't. It doesn't have to be quantitative. Um, I think we're open. Right? We're all excited to see what everyone has achieved through PHIG as well, because the idea is that we know every recipient is doing something, right? We just want to get a little more information on what you're actually doing and be able to like really build out and showcase the evidence for your practice. Part of each other. For example, I'm working on finding various skills that can maintain working on anything similar. So this is a great question. Um, I think that we are hoping to expand how recipients learn from one another. I think as we begin to collect even more practices, we'll have a lot more information on what other folks are doing. So I think you sort of hit it on the head, Jesse. I think that's actually what we're trying to extract from the PHIG recipients. So what you're doing and how you can connect to other PHIG recipients. So that's really one of the core pillars of this Promising Practices Initiative. Does the original initiative have to have been paid for to PHIG, or that now will move to that funding? So you do have to be a PHIG recipient either directly or indirectly, because the whole point is to really understand how the PHIG grant has impacted the work, right? So hopefully I answered your question. So if you have no PHIG funding whatsoever, then we won't be able to score your practice, because this is a PHIG funded initiative.
Rashida, can I
Yeah.
ask a clarifying question on that one?
Yeah.
The around the resolution of having to be paid for through FIG. So as long as it's like partially, right, and it doesn't have to be completely, is that
Correct.
correct? Yeah,
Yes.
okay.
Thank you, Christina. Yep. Any more questions? So we're going to give it probably till 3:45, unless we just see more questions flood in. Um, Again, you can always send an email to me directly or to the FIG evaluation mailbox. We'll be happy to answer your question at any time. So if you think of something later on, feel free to email us.
Rashida,
Yes.
can I ask a question?
Yes.
That I think maybe, if I was a recipient, I might be asking myself is, what if I think I might want to submit a practice or, I might have a practice that might qualify as promising or best, but I'm just not sure. And maybe I don't want to go through the whole process of doing it until I have some like clarity on whether or not, it might be accepted. What suggestions do you have for recipients who might be in that boat?
That is an amazing question. Thank you so much, Christina. So what I would do is I would send an email to either me directly or the FIG evaluation mailbox, and we would be happy to either discuss with you or send you really a PDF copy of the submission form so you can see what we're actually asking. So you can really determine whether or not you want to submit. But I will say, as sort of a best practice, submit anyway. Submit anyway. This initiative is really designed to capture practices at any level of implementation. So just because it's not a best practice, right, doesn't mean it won't get featured on the website, and it doesn't mean that it's not important to other FIG recipients or other, folks in the public health field in general. The idea is that we want to create this resource library of practices all across the spectrum. Sure, we, are spotlighting the promising and best practices, but there are recipients that are not that far in their implementation journey, and they want to know more about a particular emerging or novel practice. So all practices are important as it relates to this Promising Practices Initiative. So all in all, I would say when in doubt, submit anyway.
Thank you.
Any more questions that anybody can think of? Hearing none. Again, I want to thank everyone so much for taking the time out to attend this webinar. We really appreciate you just giving us your time and lending us your ear as we really just talk to you about what we've been doing and our plans for the future as it relates to this very, very important initiative. So if nothing else, we'll end here. Again, I'll keep saying, if you think of any other question, don't hesitate. Feel free to email myself directly or the PHIG evaluation mailbox. Thank you so, so much.